Okay. Okay, good evening, everybody, and welcome to our live Q&A session with Dr. Nick Sehkar. This evening, we're going to be going over the endoscopic sleeve gastroplasty, better known as ESG. And at this time, I will turn things over to Dr. Sehkar.
Great. Thanks, Megan. And I appreciate all of you who are joining me tonight. I'm excited to answer your questions about ESG and to tell you a little bit about my extensive experience with endoscopic solutions for obesity. I was involved in some of the first trials of the earliest devices back when I was a fellow at Vanderbilt in 2004 to 2006, and got involved with Apollo Overstitch in 2011 when the product was first released. And I have experience going back to that time and with doing over 500 Apollo Overstitch tours, which are endoscopic revisions of the gastric bypass. So I'm excited to offer this new and promising modality for weight loss, incisionless modality for weight loss to our patients. So I'm going to start by sharing my screen and showing you a brief intro to the procedure, and then I'll turn it back to Megan, who will direct some of the audience questions to me, which I'll be happy to answer. So I'm going to share my screen and just show you a brief 2-minute video which covers the major background of the procedure.
Sleeve gastroplasty, ESG, is a weight loss procedure that reduces the size of your stomach so you eat less, feel full faster. It is performed by a specially trained doctor endoscopically, which means no incision, no scars. ESG is performed using the Apollo ESG system, the first and only device authorized by the FDA for this procedure. The Apollo ESG system is a small endoscopic suturing device about the size of your finger that attaches to the end of an endoscope or camera. A specially trained doctor passes the device and camera through your mouth and into your stomach. The doctor uses the suturing device along the large curve of your stomach to sew it into a smaller shape. The stitches, or sutures, are placed in a U-shaped pattern starting near the bottom of your stomach and working towards the top of the stomach. As each U is completed, the suture is tightened down to reduce the volume of the stomach. The doctor continues to sew along the large curve of the stomach until 6 to 8 sutures are completed. With your stomach sewn into a smaller shape, you'll eat less and feel full faster, resulting in significant weight loss. See the difference. Patients lose an average of 14% of total body weight at year 1, or 49% of excess body weight. This advanced endoscopic procedure does not require incision, meaning no scarring and less time away. Most patients typically go home the same day as the procedure and can return to work in 2 to 3 days. The Apollo ESG system is the first and only device to be authorized by the FDA to perform ESG for weight loss. It is indicated in adults with obesity, with a BMI between 30 and 50, who have not been able to lose weight or keep weight off with diet and exercise alone. Learn more about the ESG procedure by visiting apolloendo.com/ESG. Patients who have an ESG must also.
So now I'm going to turn the camera back to Megan, who will direct any questions that have come up from the audience or any other curious attendees about the procedure.
Yes, Dr. Sehkar. So the first question is, how is the ESG different than a laparoscopic sleeve, bypass, or any other bariatric surgery?
All right. Yeah. So The major and most important difference is that the procedure is done totally through the patient's mouth. So the sleeve gastrectomy or the gastric bypass, even in its most minimal form, which is a single incision sleeve, which can be done through a hidden belly button incision, still requires a surgery where we have to fill the belly up with air and use a stapler and remove a piece of the stomach. Whereas this procedure is totally incisionless. There's no visible incisions. We do the entire thing through the mouth, and we place permanent stitches to decrease the size of the stomach endoscopically. So as you could see in that short video that I played, the results from most of the people that I talk to who do the procedure seems to be almost as good as a sleeve gastrectomy. We saw in the trials that the weight loss at 1 year was about 50% excess weight loss. And in my hands with a sleeve gastrectomy at 1 year, it's about 60 to 70% excess weight loss. So very close to the results that we get with traditional laparoscopic sleeve gastrectomy. And to accomplish those results with an incisionless procedure that's done totally through the mouth with very quick recovery, patients can get back to work within 2 or 3 days. In fact, I do a very similar procedure, which is an endoscopic revision for gastric bypass, and patients feel like they're totally back to normal within a few hours after the procedure, because it's mainly like having an endoscopy. They feel a little bit of bloating, a little bit full of air, but after passing that air, feel back to normal with very minimal pain and cramping. And that's what we've seen in general with this procedure as well.
And who would be the ideal candidate for this procedure?
So the ideal candidate for this procedure is someone who's 30 to 40 BMI. It's indicated up to as high as 50 BMI. But the ideal candidate would be somebody who is looking for weight loss and they've been unsuccessful with diet and exercise alone, and they need a tool to achieve the best results. But maybe they've been afraid of surgery, of having a permanent change to their anatomy, which is what happens with sleeve gastrectomy or gastric bypass. This is reversible, so it is an option for somebody who may be wanting to get pregnant down the road, and who wants something that potentially has the ability to be reversed in the future. But we do intend for it and do see it having good permanent and long-term results.
The next question is, how much weight can one expect to lose, and how would health be impacted by losing weight from ESG?
So typically we'll see the average weight loss after the endoscopic sleeve gastrectomy is 50% of your excess weight loss. So if you are somebody who's 100 pounds overweight, that would be about 50 pounds of weight loss. So let's say, for an example of a 5-foot-tall woman who weighs 200 pounds, we would see 50 pounds of weight loss, and we could expect that your diabetes resolves, your sleep apnea resolves, your high blood pressure resolves, you come off of your medications. So we expect to have the same beneficial results for these chronic killer diseases like diabetes that we would see from traditional surgery, which requires incisions and a lengthier recovery, longer, more time off from work as well.
And can the sutures rip, and what's the prognosis for long-term success?
The sutures can certainly rip, and that's why we urge you to be cautious with diet the first few weeks after the procedure. We want you to stick to liquids and soft food while the sutures are healing in place. However, it's not the end of the world if 1 or 2 stitches pull out. That's why we do redundant stitches. We do at least 8 to 10 stitches so that even if one fails, the rest are still holding. So it's like a suspension bridge. Even if one of the cables snaps, we're still depending on a lot of those other cables to hold up the roadway.
And would somebody qualify if their BMI is 50?
50 is what the FDA indication is for, up to 30 to 50 BMI. So that would be the upper limit that we would offer that for. Certainly for BMIs higher than 50, sleeve gastrectomy, traditional sleeve gastrectomy is a good option, as well as our other traditional surgeries like gastric bypass.
This is a question from Instagram. Can a post-op patient use ESG as an option?
A post-op patient can use ESG as an option. So it is an option for patients who have had sleeves and other practices where, if we do an endoscopy and we see that the sleeve has stretched out, or there's part of the sleeve that shouldn't be there, we can tighten that sleeve down with an ESG. So it is a good revision option for sleeves that have failed, or I consider it more the sleeve has failed the patient than the patient has failed the sleeve, because most cases I see where patients regain weight, it's because the surgery was not the right fit for the patient. So we never, or I at least never, blame the patient for weight regain. There's usually an organic cause for that we can solve with the right surgery.
Is the hormone ghrelin removed, or any other hunger hormones removed?
It certainly, we would suspect that, like the sleeve gastrectomy, the ghrelin level would go down, because we are, even though we're doing the surgery endoscopically and we're not removing the fundus, we're still limiting the surface area of the stomach by doing this procedure. So it does require further investigation, but patients who've had the procedure report feeling full and lack of hunger, just like sleeve patients do. So we suspect that the mechanism of action, even though it's completely endoscopic and we're not removing a portion of the stomach, that it's a very similar mechanism of action where we're lowering that amount of these hunger hormones like ghrelin, because we're not leaving behind that part of the stomach that can stretch. And when that stretchy part of the stomach is empty, it produces a lot of hunger hormone, because your stomach really doesn't want you to starve. So that is the thermostat that we're resetting to a lower weight when we do the surgery.
Can a patient with IBS have this done?
Yes, there isn't a contraindication for the procedure with IBS. In most cases, I've seen with weight loss and with just that decrease of inflammation, I haven't seen IBS get worse after the procedure, and I've certainly seen some of the more nagging complications of IBS, like diarrhea, get better after the procedure.
Will the patient have to take supplements or any vitamins?
We always recommend that patients take a daily multivitamin. You're not going to get deficient of vitamins as you would with a malabsorptive procedure like the gastric bypass. But we always do recommend that you do take a simple daily multivitamin, and do get some blood work every 3 months to make sure that you're not deficient of vitamins. And then we can correct any deficiency at that point.
Can you speak to the pros and cons of ESG?
So the pros, the major pro is that it's an endoscopic surgery. So that means totally incisionless. So that means no laparoscopic incision, no open incision. And so the patient is going to have less pain and is not going to have any permanent scars. So we see patients going back to work and full activity within 2 or 3 days after this procedure versus 3 to 5 days or up to a week for a laparoscopic surgery. So that is one pro. The other pro is that we can replicate that anatomy of a sleeve endoscopically. which is a game changer because we have a trial, the MERIT trial, that has shown that these results are durable, and there's been significant improvement in comorbidities along with the weight loss results. So not only is it leading to weight loss, but it's leading to resolution of comorbidities. So that is really something that we're excited about and excited to have the ability to offer this to more patients.
Are the sutures permanent or dissolvable?
So sutures are permanent. We wouldn't want them to be dissolvable because usually dissolvable sutures, they would dissolve within a month or two, and then the stomach would go back to normal before you had any significant weight loss. So we do expect these sutures to be permanent. However, if there was a desire to reverse the procedure or to revise the procedure, we could go down with a scope, cut out those sutures. If there was a desire for further weight loss, we could even cut out the sutures and convert to a conventional laparoscopic sleeve gastrectomy. So we're not burning any bridges by doing the procedure.
Can you convert a bypass from 2 years ago to ESG?
That unfortunately is not an option. A bypass, we can do another procedure called the overstitch or rose procedure. So if the reason for bypass revision is dumping or weight regain, the endoscopic revision that I perform is a good option. We can go in through the mouth, use the overstitch, Apollo overstitch procedure, and tighten down the pouch and the opening and give you weight loss and decrease the episodes of dumping. So that's something that we can talk about more for a patient who's had a bypass.
If a patient's had a full hysterectomy and stage 4 endometriosis, can they be a candidate?
Yes, they can be a candidate. So that's not a contraindication to the procedure. In fact, this is a great procedure for patients who have had previous surgeries or been told by other surgeons that they can have the procedure because they have too much scar tissue. So if you've been told that you have too much scar tissue to get a weight loss surgery, we can help you here.
How long does the procedure take?
So the procedure in experienced hands should take about an hour to do. So it is complex. In inexperienced hands, it can take up to 2 or 3 hours. So would certainly question your doctor's experience with this endoscopic, with any kind of endoscopic revision surgery, because somebody who started this procedure within the last month or two is not going to be your best bet for having a good result.
Is there any cases where this would be reversed?
Yes, so there are cases that this can be reversed if you have excessive emesis during pregnancy. Although we don't recommend that you get pregnant within a year after the procedure because you'll feed the baby and you won't lose any weight. But if you did get pregnant within a year and you had too much nausea, that would be a good reason to cut the sutures out, and then we could do them again once the baby's old enough and you're ready to get back into weight loss.
So when will this be available through New York Bariatric Group? And
So
where
it's
do you practice?
It's available now. We're ready to go. So you can talk to our call center, 1-800-633-THIN, and make an appointment. And I'm happy to see anyone in the tri-state area by telemedicine. We'll soon be rolling this out to our surgery center in Stamford, which is pretty much within a 30-mile radius of anybody who lives in the tri-state. And so we can take care of patients there and see patients by follow-up by telemedicine or in the office. And we also have locations in Hartford, where we will be doing the procedure as well for our patients up by New England, and further points north.
Is there any insurances that cover this procedure?
Not yet. That doesn't rule it out down the road, but the game that insurances play typically is calling everything experimental for the first 5 or 6 years that it's out before it's covered. And that's what they did actually with the sleeve gastrectomy for many years until it became covered. But in the meantime, we do offer it to our patients who want to go for the procedure, but it is outside of insurance coverage.
And what about in New York City? Where would you operate?
So in New York City, we would, because this is more than an endoscopy, it's a little bit more than an endoscopy. So if we did see New York City patients, we would bring them up to our Stamford Surgery Center location for this, or the New Jersey Surgery Center, if a patient was coming in from New Jersey for the procedure. But we will make it easy and safe for you to have the procedure. Remember, Stamford is only about 30 miles north of the city. So even though it's a different state, it's still basically in your backyard if you need to come up there.
And how long after pregnancy can you get this done?
So within about 3 to 6 months after the baby's born, we could do the procedure. There's no long-term contraindication for the procedure after pregnancy.
Can you speak to cost?
So it's approximately $14,000 for the procedure, and that does include all of the associated costs, including the surgery, the anesthesia, the time in the surgery center, and the first few months of the follow-up.
If somebody was coming into the Connecticut, what locations would you see them at in person?
Yes, so I can see patients in person at our Fairfield office and our Farmington office. We can also do telemedicine visits for anybody in the region. And those are easy to schedule. You can do the visit right on your phone.
Sorry, you had a couple of shout outs on Instagram. One patient was saying that you sleeved her about 6 months ago. Very happy, best decision ever. And you have a fabulous team.
Yes, we do have a fabulous team. And I feel lucky to get to do this every day. Doesn't really feel like a job. I get to have fun and enjoy seeing the success of my patients every day. So thank you for being part of the NYBG family. I consider all of my patients part of the family. So I'm happy to get the opportunity to tell more potential patients about what we offer.
What about can a patient still breastfeed after?
Yes, so you can still breastfeed. You would have to pump and discard the breast milk for approximately 24 hours after the procedure, after getting anesthesia. But otherwise, there's no contraindication.
There are questions about how to book appointments, if you want to speak to that again.
Yes, so our number is easy to remember, 1-800-633-THIN. So feel free to call that number. There should also be links on the website for a return contact at the Stop Obesity for Life website. You can start a dialogue and have somebody very easily and quickly schedule you an appointment.
And I'll also give out our marketing email address. It's just marketing@nybg.com. And we will be more than happy to point you in the right direction, answer any questions. So you're more than welcome to email us.
Yeah, it was a great day today. I saw a lot of successful patients. So I love following up with the patient every month after the surgery. We don't just do the surgery and wish you good luck and never see you again. I like to tell my patients, we want to share your success and celebrate your success every month. We don't want you celebrating at home without us. So we want to see your success every month. So it's the same thing with this procedure. We want to see your success every month, and we don't want you to be celebrating without us.
Can you speak at all to the pre-op process? I know there was somebody asking, they said that they did their class, but they never kind of moved forward with it.
So the pre-op process for ESG is very simple because it is just an endoscopic procedure, or purely an endoscopic procedure. It's not as extensive as a workup as the sleeve gastrectomy. So we only need a nutrition visit for every patient. If we do find that you have some pertinent medical or psychosocial history, we would require more of a visit than that, potentially EKG or blood work or cardiology clearance. But it's likely, for the most part, if you're healthy, if you have no underlying health issues, it could be a very simple process to schedule the procedure. We want to try, we understand that the hard part is picking up the phone and making the appointment. We want to make the rest of the process easy. It's a big burden to relieve yourself, and there's a fear of change. So we want to make your process easy and simple and carefree. So once you pick up the phone and you make the appointment, it should be smooth sailing after that. You'll have a whole team of people who are dedicated to your success at your disposal. You'll have a concierge who only takes care of my patients. You'll have a team, an army of people who are ready to go to battle with the insurance company or with anybody else who may be standing in your way. But we ally with them. They know that we have good results. So we really make it a team effort, and we form an alliance with you and a dialogue to get you through the process quickly and safely.
I don't see any other questions, Dr. Sehkar. I do just want to remind everybody of the phone number. We can be reached at 1-800-633-THIN, THIN. Also, if there's any additional questions, concerns, you're more than welcome to email our marketing team, which is marketing@nybg.com.
Yes, and if you do have further questions, I'll be happy to answer them, and we will plan to have these Q&A sessions on a regular basis. So if you think of a question, we'll have further opportunities to answer them. And I appreciate my award-winning team with Megan and Sandy and Carrie Lynn. And we look forward to further opportunities to serve you and answer your questions and help you through this journey and help you along the way, because it's a big step. We know it's a brave step because you've heard it from doctors, from family members, that this is something that you can do on your own. Why don't you just reduce your calories, or other bad advice? So we know that you've been thwarted for a long time, and you've been given bad advice. So we're here to give you the right tool. So we look forward to meeting you in person.
Thank you, everybody. Thank you, Dr. Sehkar. Have a great evening.
Thank you. Have a good night.